Okay, let's start the conference. Our first session will be plenary session, which will be chaired by our Professor Nathan Vaithyalingam. Without further ado, I inviting Professor Nathan to chair this session. Please. Yeah, give Prof a big hand.
Good morning, everybody. It's nice to see the crowd this morning face to face after a long, long time. I have the pleasure and honor of kickstarting this conference, the 10th Malaysian Conference on Healthy Aging, and it's also an honor to me to introduce your first plenary speaker, who happens to be a very good friend of mine for a number of years. Dr. Michael Hodin, who's an executive director at Global Coalition on Aging. He's an adjunct senior fellow and counsel of foreign relations, managing director of High Layton Group in New York, USA. I've known Mike for a number of years from the time we started the first World Congress on Healthy Aging. Mike Hodin is the CEO of Global Coalition on Aging, the leading business voice on aging policy and strategies, aimed at reshaping how global leaders approach and prepare for the 21st century profound shift in population aging. Mike is also the managing partner at High Layton Group, a strategic communication firm. He founded the Global Coalition and High Layton Group and was a senior executive at Pfizer for more than 30 years, where he created then and led its international public affairs and public policy operations. Prior to joining Pfizer, Mike was a legislative assistant to Senator Daniel Patrick Moynihan and also a visiting scholar at Brookings Institution of U.S. Foreign Economic Policy. He's a member of the Council on Foreign Relations from 2010 to 2012, was an adjunct senior fellow. He sits on boards of foreign policy associations in the Business Council of International Understanding, the New York Blood Center, the American Skin Association, the American Society on Aging, Harris Manchester College at Oxford University, Immigrant Saving Banks, and on the World Economic Forum Global Agenda for Council for Population Aging. Mike holds a BA cum laude from Cornell University, MSc from International Relations from the London School of Economics, and Political Science, a prestigious place where all of us know that. And he's also got a PhD in Political Science from Columbia University. So without much ado, I would like to invite Mr. Mike. Mind you, he's from the US, so you can know what time it is there for him now. And he's so looking forward for this congress, this conference without fail. So, Mike, I hand it over to you.
Hello, and thank you very much. Let me just test to make sure this is all working properly. I'm assuming it is. Thank you, Nathan. We are just delighted to be with you at the 10th anniversary and to congratulate you and all those in Malaysia for this very important initiative you started 10 years ago, and we hope to be with you for another 10 years. But of course, now we're also together celebrating the decade of healthy aging, which we're in our second year, of course. So the Malaysian Healthy Aging Congress 10 years ago sort of teed all this up, and we're delighted to have been with you then and even happier to be with you today. So thank you so much for having us. Let me now go into the presentation. And just to confirm that we're okay, everyone can hear me, correct? Okay. Jane, I assume we're okay, right? So let's go to the second slide. So as you just heard, we have the Global Coalition on Aging, which is a group of global companies committed to healthy aging, bringing the business voice to this topic And the cornerstone of the Global Coalition on Aging is cross-sector and cross-discipline commitment to healthy aging. So technology, pharma, healthcare, transportation, home care itself, and other consumer brands. We're delighted to be with you. And let's go to the next slide. We also have an advisory council, which of course we're delighted to have Nathan as part of our advisory council, but like our membership, it is cross-sector, global, and cross-discipline. So for example, our chair is Dr. John Beard, who many of you know, former head of Aging and Life course at the WHO. And in many ways, really, I think, Nathan, you'll agree with me, is really the decade of healthy aging very carefully. And of course, here we are now. We also have their home care company in China, Dupeng as well, from Renmin University, Esco Eho, who is former graphic transformation. We have reached a milestone. Let's go to the next slide. And of course, today, mid-century, there will be roughly 2 billion on the planet over 60. But even more profound than that, let's go to the next slide, Jane. We already have more old than young. So this age demographic transformation is about longevity, the 2 billion of us on the planet over 60, but it's also about more old than young, largely as a consequence of increasingly low birth rates as every society modernizes. And the G20, there's already more old than young, and around the world will be there very, very shortly. Next slide. So as a result of that, our basic proposition that I hope you will agree with, and perhaps you can discuss during the course of the Congress, is that society must realign for the 100-year life. And we are at that place where our children and grandchildren are likely to live for 100 years. A young girl who was born in Manchester, England in the late 90s will likely see 3 centuries. This is remarkable. We want to make those as healthy as we can. But in the course of it, it also has a transformation for society overall. Work and retirement, changing the norms. And we know that in the OECD countries, 72% of pre-retirees want to work beyond retirement. Let's give them a chance. We know that we have to change this notion of being so concerned about spending on health and containing that cost. We have to relook at spending on health as an investment. And in the context of aging, this will yield enormous returns, at least $7 for every dollar invested by 2030. And then, of course, we ask from a Global Coalition on Aging, both governments and companies, large global companies, as an opportunity. It is not about quote unquote old people, though we do want to make all of us as healthy as possible for as long as possible. But this decade of healthy aging is about all people. It's about those, even those who have not yet been born, living as healthy as possible to 100 years and more, perhaps. But the idea is a healthy aging, and we want to enable that around the world. And Global Coalition on Aging brings our companies around technology, around transportation, around biomedical pharmaceuticals, around home care, elder care, to do that. Let's go to the next slide. So, of course, I've already spoken about the Decade of Healthy Aging, which has now been launched. It is formally a decade of the United Nations, a part of the Sustainable Development Goals, and being implemented by the World Health Organization as the principal agency of the United Nations family of agencies who can work together on the decade of healthy aging. And as many of you will know, and certainly the Healthy Aging Congress knows very well, in many ways, the cornerstone of the decade of healthy aging is about reframing how we think about health, how we measure health, and measure it in the context of maintaining functional ability. Of course, we would like to defeat disease. We would like to treat disease better. We would like to cure disease, and I'll speak about a few of those needs in a moment. But we also want to make sure that we reframe how we think about it and the metric for success, which is as much about functional ability as it is about eliminating disease itself. I think we have a couple more here. So it's about, as I said, investment in health systems and long-term care, in lifelong learning, in age-friendly environments, in social protection. And as you know, the four core areas of the decade of healthy aging are age-friendly communities, ageism, or overcoming the culture of ageism. It's about integrated care, and we have ICOPE as a major program of the WHO that we encourage all of you to engage in. And we know that it's about age-friendly communities. And there are many benefits that we will all get out of it, from health to working longer to, we hope, everyone being happier. So it's at all levels of both public policy and individual. Will be at the individual level for well-being around. So we suggest that at the core of the silver economy, of course, as I said, is healthy aging. And again, congratulations to Nathan and the entire team in Malaysia for leading the way 10 years ago, creating the Healthy Aging Congress. And now here we are 10 years later, celebrating the anniversary. Our initiatives bring key insights to threats on healthy aging, with the cornerstone being NCDs, as we know. But we also now, as a result of COVID, understand more than ever that we have not overcome communicable diseases. And in that context, we understand also the challenges around antimicrobial resistance, the challenges particularly for older adults, where the lack of antibiotic innovation as a consequence of AMR is threatening all of us. But I call your attention to major chronic diseases that we want to address, at least manage better toward a functional ability, and to the degree possible, treat and cure. Cardiovascular disease, chronic respiratory diseases, diabetes, cancer, and Alzheimer's are listed as major areas of chronic disease. There's one here that's missing that I'll speak about in a moment, and that's bone health, osteoporosis, and fragility fractures, which we think belongs in this, to be added to this list. We'll show you in a moment why we believe this has been something that we haven't. Decreasing these threats is essential to a thriving silver economy. Next slide. So go back, sorry, yes. Go back to the prior slide. Okay, well, we'll stay here. So I just want to make sure you see that at the center is healthy aging, and around the edges, the critical elements of innovation, economic growth, lowering health costs over the long term if we invest in healthy aging, and prevention and financial wellness strategies. Go ahead. So I've already alluded to the fact that we believe that there is a particular area bone health, represents the profound and underlying challenges of the decade of healthy aging. And in many ways, it's not only the disease itself and not only the impact of the disease, both on health and on economy, but it's also the degree to which, in many ways, bone health, osteoporosis, is an old symbol of getting old that we want to overcome. On the left-hand side of the slide here, you see a sign that we found in the UK that goes back to the 70s, the 80s, back in the 20th century, where elderly people are depicted as hunched over. Why are they hunched over? With a cane, because of osteoporosis. And this is a sign to be careful of elderly people crossing the street. This is a traditional view of aging going back into the 20th century. What we want to do is move our view through the screen of overcoming ageism to a new view on the right-hand side, an example of aging in the new world, aging through the decade of healthy aging. But at the centerpiece of this will be overcoming chronic diseases that I alluded to that will include osteoporosis, which at its center has fragility fractures that are not only adverse impact on healthy aging, but huge cost impact. We know that roughly 80% of all those people who have their first fragility fracture are neither treated nor rehabilitated properly or effectively. And then they go on and have a second fracture. Of course, we want to approach prevention more effectively to avoid the first fracture itself. Predict and prevent, not wait for the first fracture, or certainly not the second fracture with the old 20th century acute care model, but rather the new 21st century model that one of our companies, Amgen, has spent a lot of time focusing on, namely predict and prevent. And this will lead to healthy and active aging. So I encourage all of us to make sure we put this as in part of our toolkit in thinking about healthy aging as we go forward, and add bone health to the NCD framework that we've spent so much time on over the last number of years through both the United Nations and now the decade. Let's go to the next slide. I also call your attention to an under-recognized area that has gotten a lot more attention during COVID, unfortunately, and that is adult immunization. We've had over the last 10 to 15 years or more opportunities for adult immunization to be married with the great work that we have done, we the global community, over many, many decades in childhood immunization. But as we have more and more of us living longer and more of us a percentage of society, let's add adult immunization as central features to prevention strategies in our toolkit around, and we know that there are at least 5 pneumonia. We know the particular challenges of older adults to COVID, and so now we think of COVID-19 adult vaccines, and we want to have more innovations during the decade. And when you see here on the left, this notional idea that if we expand vaccine access, we increase vaccine uptake, we will close that gap to expand the opportunities for healthy aging from the conventional one. So we want to add adult immunization to our toolkit of prevention strategies for all health systems. Next slide. We also know that a critical element increasingly with us in a decade of healthy aging is the opportunity around elder caregiving, and increasingly elder caregiving at home. One of our companies, Home Instead, has joined forces with a technology company, Honor, in the fall of 2021. It marries high tech and high touch, and will now make the reality of our living rooms, our bedrooms, our homes being in many ways the hospitals of the future. We have this ability with elder home care, but the one critical strategic gap is we don't have enough caregivers. This caregiver burden is strategic, it is huge, and it must be addressed. The Global Coalition on Aging was delighted to partner with Home Instead and the OECD on a panel, a roundtable that we had in the fall. We'll be coming out with a report within the next couple of weeks, actually, and it highlights this need for closing the gap for caregivers that will therefore expand the ability and our capacity globally to meet it. We have family caregivers, and all of us will continue to do that for our parents and grandparents and our spouses and our friends and those who we love. But having family caregivers as part of the healthcare community is something the 21st century will bring, and part of the decade of healthy aging. Let's go to the next slide. And I'd like to now call your attention to an area that I think we're all increasingly aware of, and that is the challenges of Alzheimer's and other dementias. Its impact on the 21st century is enormous. It is both staggering and accelerating, both with respect to the number of people that it traps in its tragedy and horrors, as well as the impact on fiscal sustainability and even economic growth. We at the Global Coalition on Aging do not believe it's too much to suggest that if we don't find the cure for Alzheimer's, it will bankrupt us in the 21st century. And this is because of some of the data that you see here in this little pattern that shows that the impact, more than 55 million families worldwide, a number that expected to reach over 150 million by mid-century. 150 million that will be impacted by Alzheimer's. The cost to the global economy was estimated around 1.3 trillion in 2019, and we know that's going to explode to about 20 trillion over the next decade. So Alzheimer's is not just a health challenge, it's a fiscal demand. And while there have been important recent scientific advances and policy milestones, these positive steps are neither linked nor at global scale. And as a result, the world is still not bringing the full range of collaboration, innovations, resources, and tools to this fight. We need to fight all of the chronic diseases. We need to think about them in terms of functional ability. And when we think about Alzheimer's, bone health, cardiovascular, the opportunities around adult immunization, the needs around caregiving, we know we have a lot in scope, but the opportunities are enormous to have a great future. So let's go to the next slide. And from a Global Coalition point of view, we have two pillars that we wanted to talk to you about, one coming up in the next month and a half and one toward the end of the year. And we will be sending out communications on this, but we have this relationship with the World Summit on the Information Society, which is a part of the International Telecommunications Union at the United Nations. It's a Geneva-based agency, focuses on digital technology and information. And about 3 years ago, we will have the third year coming up, starting within the next couple of weeks. it now has a dedicated track on older persons. And the Global Coalition on Aging will again be leading this track from May 2nd to May 6th. We will be sending communications out to all of you who are participating and listening today in the Congress, and inviting some of you to be on some of our panels. But we also have a Healthy Aging Innovation Prize. And we have this prize is now already open, and we encourage you to submit. We will ensure that all of you, through the communications of the Congress, have the materials for how to submit to that prize. It will still be open until April 1st. And it's a Healthy Aging Innovation Prize across multiple platforms that include adult immunization, Alzheimer's, frailty and bone health, fintech, and transportation and others. So it's not just on the health side, but also on fintech and other elements. And all of these materials will be provided through chat and in your materials so that you can look at that. And we hope some of you will be interested in both joining us in that May 2nd in Ireland. The details of that are still being finalized, but we want to make sure that you are thinking about that, and we will welcome all of you to join us at the second ever Global Silver Economy Forum to help celebrate this full second year of the Decade of Healthy Aging. We'll be able to invite many of you either online, virtually, or in person, and then move into 2023 when the first milestone report for the decade will be submitted to the United Nations. So with that, I'd like to again thank the Congress for inviting the Global Coalition on Aging to be a part. We're delighted and honored to have served in this capacity to help open your Congress. And I hope that next year we'll be able to join you in person. But at least with the beauty and the wonders of technology, we're able to be with you at least virtually. So congratulations again for holding this, and good luck in the rest of the Congress.
As well as globally. He has been an advisor to a number of organizations, etc. And I'm sure he really would have liked to be here in person. But you know, all of us know it's because of what has been happening globally in relation to COVID-19 situation. But I'm sure he'll come down next time when we have a conference. So Mike, once again, thank you very much. We really appreciate your time. And I know it's time for you to go to bed, as you told me earlier. So to be fair to you, and we are just waking up in our conference. Thank you very much, Mike.